One of the real headlines that we'd like to leave you with here today is that the vast majority of non-citizens, the vast majority of immigrants should keep their benefits, should enroll in benefits. This rule, we were thinking that it would really be all about benefits before it came out. What we saw with the real text of the rule, including what's going into effect today, is that it's much more about penalizing poverty, penalizing lack of wealth, penalizing lack of income. And because of the way in our society that lack of wealth and lack of income, or low income and low wealth, align with racial disparities, we can truly say this is a racist policy. In so many ways, it's designed to penalize people of color, people from countries where incomes and GDPs are lower and where wealth is lower. So in terms of the healthcare piece of this rule, the vast majority of people who are non-citizens, who are immigrants, who qualify for healthcare benefits in this Commonwealth are going to be just fine in the benefits that they qualify for. And the reasons for that are a lot of what Mario was just talking about. Young people up through age 20, guess what? They may qualify for federal Medicaid, but that's okay because that population is not counted. The benefits that those people receive are not counted negatively in terms of public charge. But what else is not counted? Well, pregnant women through 60 days postpartum. Women who are pregnant, even if they are undocumented, can actually receive very robust Medicaid benefits. But for those women in those benefits, while they're pregnant, it doesn't count for them negatively. Additionally, people who are adults, who are applying for their green cards, they have some kind of lawfully present status, they may qualify for a benefit like Mass Health Limited, or they may qualify for Connector Care, which is our version of Obamacare here in the Commonwealth. And in fact, Mass Health Limited, which is our version of emergency Medicaid, it's not counted under this rule as a public benefit, as a defined public benefit. Likewise, Connector Care or Obamacare subsidies and tax credits, not counted. What else is not counted? Medicare. People can have Medicare, and that is fine. The WIC program, which Mario mentioned, people can be in WIC. CHIP, the Children's Health Insurance Program, another program that is totally fine to be in. So what are the programs that people also don't have to worry about? Well, state and local programs. So the only kind of state or local program that can count negatively has to do with cash benefits. If it's a state or local program and it's not cash benefits, you're okay. It's not going to be counted. So for example, what are some state and local programs for healthcare in Massachusetts? Well, we have the Health Safety Net, or the HSN, not going to be counted. We have the Children's Medical Security Plan, or CMSP, not going to be counted. Likewise, there's different kinds of mass health that are actually state-funded forms of mass health. It may be difficult for people to know if they're in state-funded mass health or not. That's really one of the reasons why Healthcare for All is such a great resource, and Maria's going to talk more about that. But state-funded mass health, many immigrants are in a program called Mass Health Family Assistance. For these folks that are in state-funded Mass Health Family Assistance, they're okay. It's not counted as a public benefit. So the real takeaway that we'd like you to have from here is that the vast majority of people, the vast majority, are going to be just fine because the people who are applying for green cards are not going to qualify for the benefits that really count. And the people who already have their green cards for more than 5 years, who may qualify for federal Medicaid and are adults, it's not going to apply to them because they're exempt anyway.